Thank you, Dr. Shashank Joshi and Dr. Beverly Chang for those two brilliant talks. I'm afraid there could be a little bit of overlap between the talks, and if that's so, I'll skip those slides in the interest of time. So, the object of, you've heard now about the molecule, you've heard about how effective it is for weight loss, for reduction in A1C, and you heard about all the cardiovascular benefits. But that's not the only thing which you get with a drug like Semaglutide 2.4 or Wegovy. Those are my disclosures, and of course, I have been contracted by Novo Nordisk for this meeting, and this is a Novo Nordisk supported meeting. So, I'm going to just take this a little further and talk about a few other aspects of the effect of Wegovy or Semaglutide 2.4 in respect of a few other benefits that you would get when you treat. So, first let's look at the impact of Wegovy on body composition in people with overweight and obesity, and that's a question which often comes up. Will they not lose muscle? How much of fat do they lose? These kind of questions keep coming up. So, let's look at that. So, when you look at any weight loss, whether it's with diet, exercise, drugs, bariatric surgery, you cannot have plain fat loss. You will lose some muscle as well. So, the ratio, if it is maintained that if you lose much more of fat, and of course, in the process little bit of the lean mass or the muscle mass, then that's fine. So, here it's usually in the ratio of 3:1. So, if you lose say 30 kilos, then most of it will be, or 20 kilos, most of it will be due to the fat loss, and this has been shown in step 1 by DEXA scan, where improved lean body mass proportion actually it increased by 3.5% when you look at compare it with the fat mass. This has also been shown in step 6 with the CT abdominal scan studies, where there's a reduction in visceral fat by almost 40%. So, that's what we want. Most of the fat we know, the visceral fat is what is bad. And then of course, when you measure the waist circumference, a simple proxy of the intra-abdominal fat or the visceral fat, and there's a very impressive mean weight circumference reduction by 17.4 centimeters at 68 weeks. Now, let's look at the effect of Wegovy on individuals with obesity, pre-diabetes and diabetes. So, in step 10, they studied people with pre-diabetes. Now, pre-diabetes, as you know, by definition, the A1C is between 5.7 to say 6.4. So, how many of them reversed to normal? We are not calling this as remission, because strictly speaking, remission means you should not be on any drugs. But still, we have not had too many drugs in the past where you can actually normalize the glucose levels, and talking about A1Cs of 5.6 and below is not something that we commonly see. So, with these group of drugs, we are able to achieve that. So, here in people with pre-diabetes who were given this, 8 out of 10, 80% of them got their A1C down to less than 5.7. So, that's the reversion to normoglycemia. In step 2, when they looked at patients with diabetes, and this you've seen earlier also, impressive reduction in A1C, almost 2% reduction in A1C, 1.9% from 8.1 to 6.2. 82% of patients achieved an A1C target of less than 7%, and 72% achieved an A1C target of less than 6.5%. Next, let's look at some other benefits which we don't even normally think about, and this has already started happening to some of my patients. We've had patients who have been recommended to undergo knee replacement surgery, saying that you've got bad osteoarthritis, and after significant weight loss, the ortho surgeon himself says it's not needed anymore now. Your pain has gone, you're able to walk, so maybe we can defer the surgery, and that's beginning to happen. As you can see here, Wegovy showed a significant reduction in body weight and knee osteoarthritis related pain. So, the pain also actually comes down. Improvements were seen in the physical function without an increase in the use of analgesics. So, it's not due to more analgesics being used, actually less analgesics being used, and just the weight reduction here has helped. and decline actually in the requirement of NSAIDs and acetaminophen with Wegovy compared to placebo. So actually reduction in the number of drugs, and you know that NSAIDs are not very safe drugs. So actually when you lose weight with this, you need less, and of course we're getting data now that the knee replacements also may come down with this. The next is looking at the clinical benefits of Wegovy from SELECT trial. You've heard some of this earlier, and the cardiovascular disease has been very beautifully shown by Dr. Chang, so I'm not going to go into that. But one point that we wanted to say is that we heard from Dr. Chang about all the reduction in MACE and all the cardiovascular benefits. So some of us may think, oh, okay, after 6 months, 1 year, 2 years or so, after a lot of weight loss occurred, you got these MACE reduction in MACE. It's not so at all. When you start the treatment, for some reason, we're not able to explain it why, but the improvement in the MACE seems to occur soon after starting the treatment. The moment you start treating on a day-to-day basis, if you're doing a trial, and then you look at it, how much of MACE reduction, how much of MACE reduction, long before the weight reduction occurs, you're already getting benefit in the reduction in the MACE events. So that shows that there's perhaps a separate benefit of these drugs on the cardiovascular system. We need much more data on that, but it's hypothesis generating at this stage that why are you seeing these benefits even before the weight reduction is occurring. You can see how rapidly the reduction in the MACE is occurring, and in the next slide you can see by day 20 the first statistically significant result was seen, and by day 86 sustained statistical significance, and by day 20 and day 86 you're not going to get weight reduction by that time. So there's something else going on, and of course now we're also beginning to look at cognitive function and the brain and many other benefits. So these drugs, just like when SGLT2 started, do you remember when SGLT2 started? It was a pure diabetic drug, and then thanks to the CVOT trials which were mentioned earlier in this meeting, we suddenly found superiority. So actually these drugs helping to prevent heart failure. And then the cardiologist hijacked the drug, saying that it's our drug. It's not an anti-diabetic drug at all. It's our drug which we use as first line in cardiology. You diabetologists just use it for little glucose control, but it's our drug. And then came the improvement in nephrology, where when we saw the kidney trials, where slowing down of kidney function, the nephrologist said it's our drug, not your drug. So it's a good thing to have when a drug is actually claimed by diabetologists, people who want to reduce weight, by cardiologists and nephrologists. I think similar things we are beginning to see here, that it's not just a diabetic drug, it's not just a weight reduction drug, but much more than that is beginning to be unveiled. And believe me, the best is yet to come. So this is actually showing you that in orange is the weight reduction, and in dark blue is the reduction in the MACE. You can see the reduction in MACE has occurred long before the weight reduction has occurred. So this is a very good thing, that it's probably independent of the weight loss, you're getting reduction in the MACE. And obviously much more studies are already started to see whether this will ultimately become a cardiac drug, for example. Now, and that's the same thing, that if you look at the when the improvement in MACE occurred in the first 3 months, that's the time when you hardly expect any weight loss. It's only, first of all, you're going to step up the dose. So by the time only after 3 months, 6 months, only you're going to get the benefit. But you can see the reduction in MACE occurred within the first 3 months. The heart failure composite also occurred within 3 months. All-cause death also coming down in 3 months and 6 months. By 6 months, already getting statistically significant. So it obviously cannot be just related to weight loss. There's something else happening which is very interesting. So if you look at the summary of the findings of the SELECT trial, which has already been alluded to by Dr. Chang, so I'm not going to go into that. Significant, in one word, significant improvement in cardiac events, significant reduction in MACE. Of course, along with that you also get body weight changes. Now, most of the trials which have been presented so far are based on RCTs. And as I mentioned earlier today in another talk, RCTs are very good because they are rigorously controlled and they are a very high level of evidence, because you have all the residual confounders you're getting rid of when you do an RCT with a proper randomization. But the limits of that, you're still talking about 3,000 patients, 5,000 patients, 10,000 patients, still in a few thousand. You're not going to do in millions of patients an RCT. So if you want to get that kind of data, you have to go to real world. And the other good thing about real world studies is that now we are extending it, not just the few inclusion exclusion criteria that you used, but you're now using it, now throwing it open to, and then now you're getting many other ethnic groups involved, which you might not have included in your trial. So that's where the SCORE study becomes important, because the real world evidence selected from that, and much larger numbers of patients. So what is actually done here is that the users of Wegovy are compared with non-users, and here again people selected for inclusion are those who are overweight, above 45 years of age, who have had previous MI, stroke and peripheral arterial disease, no prior history of diabetes, and then they're following them up and then seeing with a mean follow-up time of just a few months. And you can see that just as it was shown in the SELECT and other trials, you're able to see that Wegovy is associated with significant MACE reduction in MACE 5. If you take 5 of the MACE or revised MACE 5 and MACE 3, revised MACE 3, CV mortality, all-cause mortality, almost everything seems to improve in those who have been taking Wegovy. So the clinical implications of such a study are that enormous sample size, you're talking about more than 1 million patients, and then the primary endpoints you can use whichever you like, and they're relevant in the real world. And it may, the preliminary results suggest that you may get results which are equal or even better than done in the SELECT and other RCTs. And finally, the specific effect on the HFpEF studies, the preserved ejection fraction, where you're seeing that there is improvement in symptom severity, that means heart failure symptoms are actually improved, and physical limitation. So when you do make them walk or do other limitations of the physical as measured by the Kansas City scoring system, you are able to find significant improvements. So what we are trying to say is that what we are discussing here today is probably epoch making, because we are discussing molecules which 5 years ago we could never have. This is the 12th edition of this update. If I just go back to the first update 11, 12 years ago, I don't think anybody even imagined that today we'll be standing and talking about a drug which not only reduces the weight, reduces the sugar, reduces heart related symptoms, reduces osteoarthritis, reduces physical symptoms. Probably there are studies going on to look at depression and probably cognitive function and definitely renal improvement. So almost every part of the body, naturally, when you have huge amount of weights to lose and we're able to effectively reduce that without too many side effects, you are going to get more and more. And believe me, the best is yet to come. And this is the 6-minute walking distance. You can see in those on Sema how much it has improved compared to the placebo. And if you put all the studies together, all the pooled data from SELECT, FLOW, and all the other studies, you can clearly see that there is a reduced risk of composite CV death or first worsening of heart failure event, a reduced risk of the first worsening of heart failure event, no significant difference in the risk of CV death till now, but more data is going to come. So with that, I'll stop my presentation, but already we have tons of questions come up. So I'm sure that your participation is very important. So let's see what questions you have sent and we'll try to answer them. Thank you very much.